Hi all, welcome to my YouTube channel. My name is Bindu Jacob and today I am going to talk to you about diabetes related complications, especially microvascular complications. If you or your loved one has diabetes, it is very important to understand this condition which will help to protect your health. So let's get started. Diabetes is a chronic condition affecting millions of people worldwide. If not properly treated, diabetes can cause a number of serious and sometimes life-threatening complications. These complications can be divided into both micro and microvascular complications. Today, we will be focusing on microvascular complications. However, I would like to briefly talk to you about microvascular complications. Diabetes can affect the large blood vessels including coronary arteries, carotid arteries and peripheral arteries, causing narrowed or blocked blood vessels. This can lead to reduced blood flow and oxygen flow to the vital organs and extremities. Diabetes significantly increases the risk of heart disease including heart attack. It also causes stroke and peripheral vascular diseases which can affect the arteries of the legs and feet, causes ulcers and gangrenes which may require amputations. Now let's look at microvascular complications. As you can see in the picture, high blood sugar can cause damage to the walls of the blood vessels. This damage can increase the buildup of fatty material. Over time, the blood vessels narrow and blood flow is reduced. Microvascular disease affects the tiny blood vessels that deliver oxygen and nutrients throughout the body. In diabetes, high blood sugar can damage these blood vessels and develop complications in the eyes, kidneys and nerves. The three most common microvascular complications are diabetic retinopathy, which is affecting the eyes, diabetic nephropathy, which is affecting the kidneys, and diabetic neuropathy affecting the nerves. Diabetic retinopathy is a complication of diabetes that affects the eyes. It occurs when high blood sugar levels damage the blood vessels in the retina. In some cases, the blood vessels of the eye can swell and leak, or abnormal blood vessels can grow on the surface of the retina. Common symptoms of retinopathy are blurred vision, floaters or small black spots, flashing lights, difficulty reading or seeing faraway objects, loss of central vision, sudden loss of vision, poor night vision or night blindness. It is vitally important to have the eyes examined at least once per year, and if you have noticed any changes in the vision, you need to contact the optician or ophthalmologist. Diabetic retinopathy is the leading cause of vision loss, but it is largely preventable and treatable with early detection and good diabetic management. The main function of the kidney is filtering unwanted byproducts and excess water through the urine. When the blood vessels in the kidneys, which is supposed to filter waste from the blood, are damaged due to long-term, uncontrolled or undiagnosed diabetes, the kidneys work harder, causing stress and damage. Then the tiny filters in the kidneys called glomeruli start to leak protein into the urine, leading to a condition called diabetic nephropathy. Diabetic nephropathy is the leading cause of chronic kidney disease and end-stage renal disease. The main symptoms are swelling of the feet and ankles, foamy urine, fatigue and nausea, increased blood pressure, and in the later stage, urine output will be reduced. Most people with the kidney disease do not have symptoms. Therefore, screening for kidney disease should be done every year. Diabetic neuropathy is a type of nerve damage that happens when high blood sugar levels injure nerves throughout the body. It is one of the most common complications of diabetes, affecting up to 50% of the people with long-standing diabetes. Diabetic peripheral neuropathy can cause serious complications such as bilateral limb pain, numbness, paresthesia, foot ulcers leading to amputation and even death. There are different types of neuropathy. Peripheral neuropathy causing tingling, numbness and shooting pain in the hands, feet and legs. Autonomic neuropathy causing variation in heart rate, sudden drop of blood pressure when standing, bladder problems such as urinary incontinence and urinary retention, digestion issues causing diarrhea and vomiting, and erectile dysfunction in man. Proximal neuropathy causing sudden pain and weakness in hips and thighs. Focal neuropathy causing sudden nerve dysfunction in the eyes, face and leg. Early symptoms of diabetic peripheral neuropathy usually occur in the toes and fingertips, expanding proximally over time in a stocking and glove pattern. Because of the numbness, injuries may go unnoticed, so you need to check feet daily, wear well-fitting shoes, and see a podiatrist regularly. Microvascular complications of diabetes are largely preventable or delayable with early detection and consistent management. This includes tight glycemic control by maintaining blood glucose level within the target. Try to keep your HbA1c less than 7 millimole. Controlling hypertension is vital as it can exacerbate kidney and eye damage. Try to keep your blood pressure less than 130/80. High cholesterol levels contribute to vascular damage. Therefore, medications like statins should be used. Adopting a healthy lifestyle can significantly impact microvascular health. This includes regular physical activity, a balanced diet, and smoking cessation. Routine screening for diabetic retinopathy, nephropathy, and neuropathy allows for early detection and intervention, potentially preventing severe complications. Tell your healthcare team if you notice changes like blurry vision, swelling in your feet, or pain in your legs. Early treatment makes big difference. Microvascular disease can be serious, but with regular care and good diabetes management, you can protect your eyes, kidneys, and nerves. Thanks for watching, and don't forget to subscribe for more tips on living well with diabetes.